Good evening, sir.
Good evening.
We can start. We can start.
Okay, can you make me as a co-host?
Sir, you are the co-host. Sir.
Is it clear now?
Yes, sir. Clear, sir.
Can I start now?
Yes, sir.
Yeah. Pranams to one and all. Very good evening. My sincere thanks to our HOD sir, Dr. Mohan, for giving me the opportunity for this short-term course program. Now I am going to present yoga therapy. It's a general concept which has to be followed for our therapeutic approach. So yoga therapy, it is in Chikitsa Krama. Chikitsa means treatment. The yoga has to be used as a therapy for certain conditions, which will be followed by many methods. So treatment of any condition through yoga, it is Chikitsa Krama. So there are many methods to follow. First one is we have to know about therapeutic basic concepts. So therapy is very, very simple comparing to normal general well-being yoga practices. So if you are a regular practitioner and knowing about the advantages, effects, and the contra factor of yogic practices, then only you can step into yogic therapy. So yoga therapy is offshoot of our regular yogic practices. Again, it is very simple and the basic practice of yoga. So no need to go for any advanced practices. You can give any effect of our practice through our experience or by modifications. So one more thing we have to keep it in mind. We should have a motive of cure, nothing more than that. So if you are starting any therapeutic approach, we should keep only one in mind. We should have a motive of only curing, nothing more than that. For example, if one person is familiar with treating back pain or neck pain, one more person may be familiar with diabetic and obesity, one more person familiar with psychological disorders. So in this group, we may be knowing each other. Suppose if you are unable to, if you are not confident enough to cure some condition, you can refer others, or you can refer other alternate treatment methods. Whatever it may be, our motive should be cure. Next one, pariksha, that is diagnosis process. So yogic diagnosis, it is called pariksha. It is more important than treatment, because if your diagnosis, it can be yogic method or any other method, if it is wrong, your treatment also will be wrong. Again, I'm repeating, this is very, very important. Than treatment, your diagnosis process will be perfect, then only you can lead for correct treatment methods. There are 5 examination methods. 5 examination methods. One is observation, that is called visual observation. Visual observation is called observation. One more is palpation. By touching, we will know something. By visual observation, we will know something. Interview with the therapeutic member, it will give some more ideas. And pulse reading, nadi pariksha, and more is vertebra examination. So we should be familiar with all these diagnosis methods. So observation. So observation can be in seated position, standing position, lying on supine position, or prone position. In seating position, we have to observe without any prejudging. So simply if we observe, we will get many ideas where to start, where to end, how to cure the things, many things we will get. If you have prejudging character, your observation will be very poor. So you should have nothing in your mind, simply you observe, you will get many ideas to start with. So seating, how they sit, it can be in a different way. They may be leaning on one side, or their leg position, their hand position, how they look, how they answer, many things can be observed. In standing, again, whether they are in symmetrical pose or asymmetrical pose, or how they may be loading on one side, that they may be standing on one leg and other leg may be free. Like that, many methods you can observe through standing. And lying position, supine. Supine means lying on your back. So we have many observations. Abdomen, how it looks, or your neck bending, or gap between the back of the neck and leg bending positions. Many things you can observe in supine pose. In prone pose, again, you can observe your vertebra examination is different, but you will get the same ideas what we are seeing in lying supine posture. Same thing will be in prone also. Then we have same observation, that is visual observation in static point. Before whatever we did, it is static point. This is dynamic. How the person walks, how he is sitting, how he is standing, sitting to standing, standing to sitting. And then about the movements, it can be from all the joints. So this will give you more idea for Sukshma, that is loosening type workouts. You can decide by these 3 things, that is the range of movements, any range, or direction, how it is, and the quality of the movement. These 3 things will take you to proper way of giving Sukshma or stretching workouts. So pain and discomfort on movements, that also you can observe. Then how their body is compensating. If one side is weak, then how they are compensating from other side. These are the things can be observed in dynamic movements. Next one is palpation. So this palpation will give you again some more information. neck and nape region. These are the main points for palpation. Muscles and abdomen muscles, lower back muscles, tremor on finger, tremor on your toes, and if they raise the leg again, there may be weakness on raising, and the temperature sensation. It can be a temperature sensation. Things you should not compare with your temperature and with the member. So you have to see the difference between both sides, left and right. So comparison should be only from their activities and from their body. And finger grip, how the finger grip is, swelling also. Swelling also, again you have to compare with left and right portion of our body. This will give some more ideas. Then interview. So interview, in the first sitting itself, they won't open all their conditions. So they may tell one by one. Sometimes they may forget. So if they are telling some basic, we can record some basic information like name, age, qualification, occupation, and everything. So occupation also will give you some sort of predisposable factors. If they are working in a polluted environment and all, they are prone to some diseases. And nature and working nature, whether they are working under stress or working always sitting, whatever it may be, then they will have one chief complaints. Then they won't come with a single complaint. There may be main complaint that you have to note it down. Depends on the main complaint, they may have something more which may be associated with the main complaint. So definitely they won't come to you with one concern. They will have more complications, then only they will come to yoga. Then again, family history. This interview, you should not stop only while they are joining. When they join, you are noting down everything. And whenever you do the workout, again you have to speak with them and get some more information, which may help you to cure them better. One case study I can tell you. One person came to us for knee pain. One day I asked from which center she practiced, and she is practicing for more than 3 years, but still she had knee pain. Then I was talking with her in every moment. Then we have to know so many traditions. That means about other centers, about our friends, what they are giving. We have different traditions in our country. In Chennai also we have different traditions of yoga. Then you have to know every tradition what they are doing. So it means if she is done with some tradition, no need to give the same workout again to her to overload. Then I have removed some 4 or 5 workouts and she was all right. So I never given any new workout to her. I have removed some 5 or 4 workouts which is affecting her knee pain. Then she was all right. Why I am telling is, so all the workouts are not suitable for everyone. So all the traditional way of approach, again it won't give. So we have the limitations with each tradition. There are limitations, there are advantages also. If you know all the traditions, then you can cure them very easily without adding them more workouts. So just I have removed 4 or 5 workouts, you are all right. Then family history also, it may be useful for hereditary problems. And Nadi Pariksha. And Nadi Pariksha, Vada, Pitta, Kapha based thing, or you can deal only with pulse rate also. So pulse rate will give you an idea to form a workout like Brahmana, Lankana, and Samana. One more thing, every activity, it can be yoga or our routine activity, it will have 3 effects always. One, it may energize you, or it may balance your activity, or it may calm down your activity. So this energizing, balancing, and calming down, it can be read through pulse rate. So depends on the pulse reading, we can form workout also, that we can discuss later in the second part of our program. Then examination of vertebra. Vertebra examination, again these are all three deformities of vertebra: kyphosis, lordosis, and scoliosis. So kyphosis is a hunchback. So mostly you can find this on old age or people who are affected with respiratory problems. So these two things are very common. Other than that, they are working straight, continuous sitting on the computer, and always they may be bending on the front and doing some activities. They will have this type of deformity. Mainly, this will affect their respiratory and circulatory system. Okay, this we can find out very easily by these two methods. One is ask them to lie down. Then, if their gap between the neck and the floor is more, they will have kyphosis posture. And the next right bottom picture, you can see this ear and the shoulder should be on the straight line. If it is forward or backward, it is sorry. If it is more forward, it is kyphosis. Okay. Next one is lordosis. So this you can find with many of our people, particularly people who are having more belly size, or with pregnant women. So this can be reversed by giving more of forward bending and some modification of backward bending. You can avoid this. And people who come with lordosis try to avoid back bending without any modification. So back bending is better to modify, or you should know, sorry, back bending you should not give, or you can try to give back bending with some modifications which will not aggravate the lordosis condition. Mainly Surya Namaskar postures and all, we can modify in such a way which will not affect your lordosis. So otherwise, with the normal practice of Surya Namaskar, definitely it will aggravate this condition and it will lead for back pain. One more is scoliosis. So this scoliosis, it is a shoulder deform, will be right may be up or down. It will not be in the straight line. So again, one more case study I can tell about this scoliosis. So one person came for scoliosis therapy. We have given the scoliosis therapy, and it indirectly helped for menstrual disorders and for pregnancy also. So abdominal organs, it is affected by this scoliosis posture, and if it is reversed by therapeutic massage as well as asanas, modified asanas, which was improved lot in short period, she got many other benefits also. That's what I want to mention one more time. There will be side effects in yoga, but it will be positive if you are doing it the right way. So if you give some workout for certain condition, it may cure other conditions also. In such a way, you have to plan and do the workouts. And again, this is vertebra. This, if you are finding some problem on the spinal area, you should know which area is for what. For example, if you have cervical issues, it may affect sense organs, upper leg movements, and the respiratory process. If it is thoracic, again it will be circulatory and digestive systems and everything. If it is for lower spine and the lower spine and all, it will affect the sexual organs and puberty and everything. So these type of things you should know which vertebra, that is the C1, C2, C3, like T1, T2, T3 and everything. Wherever you have problem, it will be related with particular organs. So that should be studied in the beginning, and through this also you can do treatments. Okay, we will have by doing all this diagnosis process, we can come to a conclusion. That is, we have to understand the problem. That is, understand the problem is here it is disease. So we got to understand the disease globally, and you have to understand that this is for the particular person, how it is for the individual also. It is called Hayam. And Hetu. Hetu means it is the cause, root cause of the problem. And then we have to plan Hanam, that is therapeutic goal. Therapeutic goal can be a short-term and long-term goal. For example, people who are coming with pain as well as some other system, some other problem. So we should start with the pain management and then to proceed to next. And goal is not only for the disease, even where to start. Maybe we'll have many methods to start with, where to start and where to end. Where to start and where to end. It is applicable both for disease to condition to condition, or workout to workout, any workout. Which workout we got to start first. So that is therapeutic goal. It is short and long term, and that should be done by selecting the proper tools. That is upaya. That is a remedy. Okay. So up to now we have covered diagnosis process generally. If you have questions, I can clear, and then we can proceed to the next one. So this Heyam, Hetu, Hanam, Upayam is in Tirukural also. Noi Nadi, Noi Mudal Nadi, Adutanikum, Vayanadi, Vaipachayam. This is disease and it cause, and what may be effect of the ill. We got to examine everything and we got to use the right. It is not only for disease, even it is for our regular problem, whatever it may be the problem. Okay. So, if any questions, please ask regarding diagnosis. Any question?
Continuous cough.
Sorry, again.
We can't understand where it comes. Continuously cough. The person is suffering from cough.
Okay.
What is the actual cause of that? Tuberculosis, no tuberculosis. Examination is over.
So you have continuous coughing.
Yes.
Okay, it is generally we can, so without seeing the person, roughly you can tell. If you directly go through this interview, whatever we discussed now, Darsanam, Swasanam, and Nadi Pariksha, everything, if you do, you can tell correctly. This is mostly because of respiratory issue.
What, sir?
Respiratory.
Yes.
Lung, breathing issue.
Lung, yeah.
Okay, you will have breathing issue. So if it is continuously, if you have a phlegm formation, or it is dry cough. Hello, it is phlegm formation and it is dry cough. Dry cough or wet cough? Hello.
Is the reason any allergy problems?
Yeah, allergy will come purely because of your respiratory issue. So that can the allergy can overcome if you have proper breathing.
Yes.
Yeah. You can cure allergy through two things. Allergy, there is two reasons. One is lack of breathing. One is your poor metabolism. Okay. Do you have any metabolic problem like gastric, acidity, constipation, anything?
All these problems causes.
No. You have that's what it is for you or exam purpose.
Yes.
Hello. I
Hello.
think you are not answering my question.
Yes, I'm
This
hearing.
is for you or for academic purpose. Question.
Yes.
Okay. So, do you have any issues on digestion?
Digestion, there is no issue.
No gastric acidity, bloating.
No, gastric acidity is there.
Is there? It means you have metabolic issue. So that's what I'm telling. If you have both, definitely your energy level will be very poor. You have to improve both.
For what asanas?
Yeah, we can discuss. This is only diagnosis now.
Yes.
Okay, next we can cover something related to this, your question. And if not, you can ask me again at the end of the session.
Yes.
Okay.
Okay, sir. Thank you very much.
Sir, I have a doubt.
Yeah.
Sir, suppose a person is coming with a lower back pain and he is not having any medical reports with him. So how will we identify whether the pain is because of the muscular pain or it is because of the bone degeneration or because of the disc problem? How will we distinguish without a medical report? Is it possible?
See, there is one thing you have to make it sure. If you don't have any degeneration problem, okay, degeneration problem you can find out very easily in scan and all. Okay, so if you are not finding anything, you don't have degenerated issues, so we can go for practice, no problem.
No,
So
sir,
first we will, yeah.
My question is how to identify whether it is a problem with the bone or tendons or it is with the muscles.
No need to identify. We have some process to start with. If you have pain, there are some steps to start. One is pain relief, movement. I have told you that the quality of movement or where it is affected, and then we have to go for mobility, and then to strengthen process. So if you go step by step, you can come out from this.
Sir, sometimes it says that if there is swelling, we should not do movements. Some practitioners say if there is swelling, you should do movements. So,
no, don't listen to them. They are telling not to do movement. They are telling do movements. If you do movement, if you have a problem without doing movement, we have many methods to do. Are you getting problem in movements?
No, sir, it is not my condition because I have observed some people like they are having swellings, and some yoga therapists used to say you should not do movements. While in other sessions, I used to hear some people used to say you have to do movements. So how to diagnose whether a person should do movements or should not do movements?
So when you do the diagnosis process, ask them to do some stretching or yogi practices and find out where they are getting problem. Okay, whether it may be in forward bending, it can be in backward bending, or when they compress the abdomen, they may get pain and this thing. You have to identify. Don't ask them to do again and again. If you are doing again and again, the pain will aggravate. So within 1 or 2 movements, you have to find out what is the problem. Then according to that, you have to select and modify the work. Roughly, you can't say.
Okay, so for all swelling, if they are possible to do it without much pain, is it okay to do movements?
Again?
For all swellings, if they are able to do the movement without much pain, is it okay to do?
Yeah, no, they should not get pain at all due to our workouts.
Okay, so
they should not get pain. Once if they are getting pain, you should know how to relieve it.
Okay.
If for 2 things, suppose if they can't do movement at all, means you start with the oil application. Okay, oil application. With the oil application, there may be they'll have pain reduction. Then you start simple movements. Then slowly you can progress. There are many methods.
Okay, so the first idea is to relieve the pain and start the therapeutic approach.
Yeah, better to go for oil application if you are unable to move.
Okay, thank you, sir.
Any other question? Can you go to the next? Sorry, it is not audible. Again?
If the type of body will affect the therapy, sir? If so, how to identify the type of body?
One more time, please.
Whether the types of body, Vata, Pitta, Kapha, now we have combination body also. How to identify the types of body? Because to my knowledge, it will affect the metabolism, whatever conditions they are in.
Okay.
So we need to identify the type of body, na, sir. How
Yeah,
should we identify?
that is through Nadi Pariksha. That is through Nadi Pariksha. It is an Ayurvedic concept, Ayurvedic and Siddha. You can identify the Prakriti and then you can do the workout. Or there are some workouts which will balance your Prakriti. It can be workout, the workout in the sense yogi practices, or diet, or some simple herbal. You can balance the Prakriti. So without balance the Prakriti, the result you can't expect. Like a Trifala Choran example, you can use it for balancing the Prakriti. Some Vasriya Pranayama, it will balance the Prakriti. Well, whatever it may be the condition, it will balance. Any other question? Okay, I'll move to the next question. So next one, sorry. So by this diagnosis process, I told you we come to the conclusion, the Heyam, Hetu, Hanam and Vayam. This can be expanded in this way. First one, we have to understand the disease or pain, whatever it may be. Then, but for the individual condition how it is, then root cause of the problem and symptoms what they are facing. For many diseases, there are symptoms. The symptoms you have to note it down. What are the symptoms they face? That will give you an idea for your remedy purpose. And then complications. Due to the particular condition, they are prone to get many diseases. That also you should know. And predisposing factor. Predisposing factor, example, if father and mother having diabetes means their children are they are prone to get diabetes, right? In such a way, you have to ask whether their father, mother had any diseases and all. That also can be included on your therapeutic goal. And then aggravating and relieving factor. So as we discussed now, there may be aggravating, and for example, back pain, if you travel by bike for more than 20-30 kilometers per day, definitely your therapeutic workout will not give any results. So like that, aggravating and relieving factor you should know, and you should know how effective your treatment is, how effective they are contra factor. Then therapeutic goal, it can be symptomatic also, disease oriented or workout oriented, where to start, where to end, then everything you can plan. And then remedy by different selection of tools, that is called upayam. It can be a preventive purpose or it can be reversal or curing purpose. So these are like a list you have to keep. It is you have to form a protocol list, depends on the experience. This is written by some sort of experience from my side and learning from our university. And the same way you can form a protocol list. If whoever comes to you, you should have a questions like this about the problem and what are all the you should know what is diabetic, what is back pain, how it will aggravate, what are all the types of diabetes, and what will be the root cause, and what are the symptoms they are facing. So all the members will not have the same symptom. If they have the problem for 1 year, they will have 1 or 2 symptoms. And if they have more than 5, 6, they will have different additional symptoms also. That also you have to note it down. Then if they have some particular condition now, again they will get many complications in later stage. And today, same time also they will have complications also. Because of one disease, they will have other disorders. That also you have to note it down. And predisposing factor and aggravating factor and relieving factor, it can be anything. It can be your detoxification, like every day you have to detox. It can be thought pollution, it can be pollution through air, water, or food, and your relaxation may be very low. You may be working for more time. You may be working on one particular posture every day, whatever it may be. We note it down everything. Because I can tell you one more case study also for aggravating and relieving factor. And therapeutic goal is very, very important. Whenever they come to you, don't go for long-term goal immediately. So which cannot be cured immediately. So take some decision of therapeutic goal which can cure them immediately. Then only. So if you try to form one workout for a particular condition, it may cure one or two more, and slowly you go to progress. The aggravating condition, I told you two cases I can tell you. This urinary stress incontinence. I had two members. One was around 80 years old. One more was 25 years old. So 80 years old, I have stopped this condition and stopped this urinary problem within a week. Then I got more confident that I can cure anyone, because 80 years old member is cured means I thought everybody can be cured very well. Then one more person came and he had the same condition. I told him within 10 days I can cure it, but it took more than 35 days. There is no cure at all. So same work, same workout, more than that I'm analyzing everything and giving, there is no cure at all. Then one day, again, I told him in the beginning, you should have interview again and again. It is not only in the beginning, during the workout also you should have some interviews. When I discussed, he was telling he is doing some other activities, like many other physical activities. I don't want to mention it. So then one particular physical activity, I told him to stop. Then immediately after 1 week, he is okay. So this aggravating condition can be anything. It can be on his routine, or it can be with other sort of activities, whatever it may be. You should identify and stop it, because whichever is dominates, that will stand. For example, if your curing factor dominates more, you will get more cure. If his aggravating dominates, we can't cure him at all. So it is not because of the age. The aged patient is following only what I am teaching. So he is cured fast. This young person is following something else. So for his other conditions, he is doing some other workout, which otherwise is urinary continence. So I told him to stop it. He was all right in 1 week. So you should know the aggravating and relieving factors for every disease. Okay. Then we will go for therapeutic goal tools. Sorry, something is hiding now. Okay, therapeutic tools. So this is yogic therapeutic tools. You have loosening workout, it is sukshma, and the Surya Namaskara. We will go for asanas, pranayama, mudra, bandha, chanting, and meditation. So these are all the yogic tools for curing any condition. For example, loosening we have Surya Namaskara is more effective than loosening. Asana is more effective than Surya Namaskara. Pranayama is more than asana. Mudra is more than pranayama. So bandha is more than a mudra. Chanting is more effective than bandha. Meditation is the effective tool compared to anything. Why I am mentioning this? So if you are using meditation, for example, you should use in a right way. So if you are giving a wrong type of meditation and if you modify as you like, it may give more contra effect, and if you are giving in the right way, it will give the best results for you. So unless otherwise you are familiar with any tool, don't give. Okay, depends on the condition. You should know how to select the tool and how to modify the tool. That I will explain you in the next slide. Then chakra cleansing, energizing, balancing, it will work very well. And diet again plays a major role. And modification of all the tools you should know. Why we want to modify, I will tell you at the next slide. So this modification you got to make. It should be according to the function. What functionality you need. Now, two people are asking, they have back pain. You have the functionality to relieve the back pain. So functionality is, it can be forward bending, it can be stretching from a particular area, or it has to be strengthening part of different areas to cure one condition. Okay, so according to that, you have to select the functionality. And one more important thing is that the ability of the student, because whatever the asana you are selecting, that particular student has to perform. Otherwise, you won't get results. Or you can modify the asana or pranayama, whatever it may be, according to the ability of the student. So simply by giving postures alone, it won't work. If he is not performing, it won't work. Then you have to make him to perform by basic training, or you can modify in the same way and make him to get the same results. Okay, these two things. And through Pariksha also you can modify. When you do the modification, you have to keep three things in mind. One is function you have to get, and the student has to perform very easily, without any pain. That's what we discussed. Without any pain, he has to perform. And then Pariksha will give you many ideas what to do. Okay, so this should be modified. For example, Surya Namaskar, for many people are telling that the knee pain, if they have, they should not do Surya Namaskar. Back pain, if you have, they should not do Surya Namaskar. You are correct. Nothing wrong in it. But what you have to do is, you have to prepare him in such a way, Surya Namaskar will not give any pain. That is one method. One more method, some postures of Surya Namaskar can be avoided, or it can be replaced with some other asana to avoid the pain. This is called modification. Same thing for asanas also. Pranayama, again, you know which pranayama to give, which pranayama not to give, that all the yoga teachers will be familiar with. And one more modification, what we can do in pranayama is only components. Like we have inhale, exhale, hold, and exhale, hold. We have 4 components in the pranayama. So you can inhale and exhale, you can change the ratio. And some people you can ask them to hold, some they should not hold. Some they can hold in inhalation, some they can hold in exhalation. So something like that, these type of modifications you can give in pranayama. One is selection of pranayama, one is follow as it is the classical method of pranayama, or you can modify according to the record. So this will give good results. And then you can go for chanting. Chanting again, as I told you in the beginning, we have energizing chanting, balancing chanting, or calming down chanting, which is in meditation also, that you can select and modify, or at least if you know to select the chanting, this is better. How you will be knowing this? Purely by practice. You can hear, you can get knowledge from others, that is one way. Other way is you have to practice and see what is happening when you do Surya Namaskar in different patches, asanas in different patches, modification in different areas, pranayama with modifying the components of inhalation, exhalation, inhale, hold, exhale, hold, whatever it may be. Practice yourself, then you will be familiar with the therapeutic methods. Then diet and nutrition, again it plays a major role. And kriyas, satkriyas, and Sangha Prakshasana. Sangha Prakshasana, I want to mention one more. Classical Sangha Prakshasana, definitely you may be knowing, in the books they have given some contra factors. For example, if they have reflex, if they have acidity, or more of ulcer, these things is contraindicated for Sangha Prakshasana, even for high BP, whatever, these are all. So for certain conditions, Sangha Prakshasana is giving very good results. Then what we should give, you have to modify. You have to modify the Sangha Prakshasana workout without giving any contra effect, and it will reflect on your metabolic activities. So anything can be modified if you have knowledge. So this I already told you, Brahmana, Lankana, and Samana, of course, it can be with by observing the person, whether he has to be calmed down, or if he is very dull, we have to energize him. The Brahmana is energizing workout, Lankana is calming down workout, Samana is to maintain him as it is, maintain his activities as it is. It is not only with the pranayama practices, with any practice, by seeing his energy level, you have to decide which one to be given. And again, loosening part. This I already told you. Loosening is very, very important. It will give you circulation. We can call energy circulation, pranic circulation, blood circulation, whatever it may be. This is very, very important. Every day you have to do. The circulation only the benefit improved by this loosening. It will improve other activities also. It will not be harmful. If you do higher practices, you will not get any injury. Many benefits are there by doing this loosening of core and stretching depends on their requirement. Then Surya Namaskar, these are the common Surya Namaskar practice we do with some tradition. And Surya Namaskar is not a fixed workout. Depends on the requirement. You can modify any posture or you can remove and add anything which will give more benefits. And asanas, again, it is you should know to select the asanas for the particular condition, and you try to modify the asanas. Depends on the ability of the patient, depends on your knowledge also. If your knowledge is used for modifying the asanas to get faster results. And pranayama and meditation already we discussed. And other than yoga practices, so you should know at least one more system which will give better results. For example, I told you, if the movement is giving problem, start with oil application. So if it is a very minor one. If it is still intensive pain, go for therapeutic massage by selecting the correct oil. And one more is foot reflexology. Again, without any movement, you can do foot reflexology also. Marma and acupressure points, acupuncture and healing. There are different type of healings out there that you can do. Reiki also you can do. These are all the things which can be added to yoga to get better results. All the yoga therapists, they should have one more specialization on any one of these. Then only you will be a successful therapist. So, for example, pain management, therapeutic massage will be very useful for conditions like back pain, neck pain, shoulder pain, migraine, headaches, and foot reflux is very good for relieving your hip pain and urinary infections and all. You can cure very easily. Like that, every system is having its own benefits. But if you have to approach the right person and use the right technique for curing the same condition. And okay, that's all. So, any questions on therapeutic side?
Good evening, sir.
Good evening.
Could you please explain that I did not get that the modifications according to energy levels, Brahmana, Lankana, and Samana?
Okay. For example, if you are one member is coming to you, he is more active, hyperactive. So what we have to do? We have to go for Lankana practices. That is to calm down his activities. For that, you have to do more of forward bending. Exhalation should be more. And when you do pranayama, you can go for Nadi Suddhi, Sheetali, Brahmari. This type of workouts, it will calm down. Okay. Suppose if anybody is very lazy, okay, if they are very lazy, if you want to energize them, so you have to go for Lankana practices. Lankana effect you will get on back bendings. So like Bhujangasana, Ustrasana, Virabhadrasana, this type of asanas and all, it will activate the energy. So there will be improvement on energy. And pranayama side, you can modify some pranayama. If you want to give directly energizing pranayamas are Kapalabhati and Bhastrika. Okay, these are all examples for adopting Brahmana and Lankana practices. Clear?
Thank you, sir. Okay, sir. I misunderstood. So Brahmana is basically
Energizing.
energizing,
Yes.
energetic. Okay.
Yes.
Thank you, sir.
Namaste,
Good
sir.
evening, sir. I have a question similar to that the one just asked. Suppose you have a person who is highly depressed and the energy is low, but at the same time, she's also suffering from hypertension. So then in that case, what kind of pranayama can we give?
Very
Other
good.
than
Very
samana?
good. So you have to analyze in this way. Suppose if you are giving, if you want to make him calm down more and more, again he will become very lazy. That's what you want to say.
Yes,
Right?
sir.
If you give Brahmana practice, again it may aggravate his BP.
Yes, sir.
So which is important?
To keep him calm, balanced, maybe.
No. So calm down. Correct. Your target should be on hypertension.
Oh, okay.
Okay. At any cost, it should not aggravate. Correct or wrong? So at any cost, it should not aggravate. Then that's why I told you this goal should be on short term and long term. Where to start? It is very important in therapy. Okay, where to start? It is very important. So where you have to start? You should be very careful not to raise his hypertension, BP. So start on calming down course in BP, and he may not be. There will be no problem. He may not be lazy. I think so. You have to find some other method to energize him. So this energizing method will not increase the BP. Got it?
Okay, sir. Okay.
Energizing methods, it will not increase the BP once his BP is coming down. Then after that, you take him like Yoga Nidra, Brahmari, Sheetali Sheetkari, chantings like that. Chanting is calm. It should be calming one.
Yes. Okay.
It is calm down process. Once his BP level comes down, mostly he will be all right. Then another one secret I will tell you about therapy. Therapy is very easy, and in the beginning you have to use the correct tool. In the beginning, for example, 2-3 weeks, if you are in the right track.
Okay, sir.
2-3 weeks, if you are in the right track. After that, whatever you give, it may balance him always.
Oh, okay. Okay.
Okay. Beginning, you should be very careful.
Oh, okay.
Yeah, beginning you should be very careful, and you can now many things are there to diagnosis.
Okay, sir. Yeah, got it.
Just observe him. He'll be. Once BP should be taken care first.
Okay, sir.
Sir, namaste,
Thank you.
sir.
Namaste.
Sir, any back bending asana to increase your energy, right, sir?
Sorry again. Yes.
Okay.
So Surya Namaskar. Again, even if you have forward bending also, Surya Namaskar is also an energizing process.
Those who are suffering from BP, Surya Namaskar forward bending asana is not done by Padahastana asana, sir.
One more time. Repeat.
Those who are suffering from high BP, sir.
Okay.
In Surya Namaskar, while doing Surya Namaskar, can't do the Padahastasana, sir?
No, not in the beginning. Don't give in the beginning. You should know the process, how to prepare and bring him to Surya Namaskar.
Okay, sir.
So basically, you mean to say that any a person who comes with a problem, we have to modify the regimen, like give him very slow and then increase, like slowly modify the practice. Like Surya Namaskar also, we can make them do sitting on a chair, no, sir?
Yeah, when sitting on a chair, you can do, or give some selected patches. Don't give all the 12 patches.
Yes. Okay.
In a relaxed way, you can give him anyone. Then he will be adapted for Surya Namaskar. That also, it may come down.
Thank you so much, sir.
Sir, you have mentioned some mantras will be energizing and some will be relaxing. Can you put forward some examples?
Example, the Omkara, you can split into Ahara, Ukara, Mahara. You may be knowing. A-U-M, right?
Yes.
Ahara is only ahara, it is brahmana, it will energize. Okay, yum, it is lankana. U is samana.
Thank you, sir. And
Okay.
is there any in meditation level?
So same thing, you can, if you think Brahmari is Lankana, it is laxing because it is Mahara chanting.
Okay. Okay. What about meditation? Is there? Can you put forward some
It is
example?
very big question. Meditation. So you should know to, for example, Osho's meditation. If you attend, you will get all the ideas. If you attend Osho's meditation, you have hundreds of meditation techniques. You will get all the effects. Actually, you got to select and do. Don't. This is my point. I don't know. No need to modify the meditation practice. Try to select which is giving what type of effect. So our HOD sir is very much familiar with scientific evidence of meditations. So he can answer well. And my concept is better not to modify the meditation. If you practice yourself, you will be knowing which will be for meditation purpose, sorry, for therapeutic purpose. I'm not talking about meditation purpose.
Okay, thank you, sir.
So practice and find out.
So namaskaram, sir.
Namaste.
Those who are suffering from kidney problem, which asanas is given and which pranayama is given to such?
Which problem?
Those who are suffering from kidney problem, sir.
Kidney.
Which asanas is shoot for kidney problem and which pranayama is shoot for kidney problems? That's why I want, sir.
Majority you should take care of water-based treatments. We have to reduce the load for the kidney function. Mainly asanas means Trikonasana, Parivartana Trikonasana, and Katti Chakrasana, Ardha Katti Chakrasana. This type of standing postures, it will be very helpful. And one more, you have to improve the metabolism. Okay, metabolic activities he has to improve. And major concept is water quality. Other than yoga, or more than yoga, water quantity and quality is very important.
Thank you, sir. Thank you. Namaste.
What is the method to improve the metabolism?
Again?
What is the method to improve the metabolism?
Metabolism, we have many, Sangha Prakshalana, it will improve your metabolism. And Jadara Parivirti, Jadara Agni, you may have heard about Jadara Agni, that is twisting postures, like Ardha Matsyendrasana, lying down and twisting, forward bendings, like Paschimottanasana. These type of asanas will improve the metabolism, even Surya Namaskar also. But why I am not mentioning Surya Namaskar, this asana means like before, if you have back pain, you should not do Surya Namaskar, right? Like that, you should find out the right process. Surya Namaskar will improve metabolism, Ardha Matsyendrasana, Vakrasana, and Jadara Parivirti, Sangha Prakshalana, everything it will improve your digestion issues. But to try to find the condition. If this is not affecting anything more, it's okay. Other questions? Okay, thank you. My sincere thanks to our HOD sir, who has given me the opportunity to discuss with you. Thank you very much. Thanks.
Good evening to one and all. Is it audible?
Yes, sir.
Yes, sir.
Yes, sir.
Yes, sir.
Okay. So as far as research is concerned, some important concepts that you have to be thorough, like scope of research, hypothesis, questionnaire, variables, types of research, sampling design, experimental designs, descriptive research, and also very important is research report writing. So your duration for PhD is, if you have completed MPhil, if you are regular, 2 years. If you do part-time, 3 years. If you didn't do MPhil and if you have done only PG course, then full-time is 3 years and part-time 4 years. But anyhow, at the end of your duration, you have to submit this, you have to prepare this research report writing and you have to submit the dissertation. MSc or MA, we used to tell thesis. Anyhow, this is very essential part, research report writing. Because by submission of this dissertation or thesis, then only you will be given degree. So far we discussed everything there. And today it is a last day. We are seeing an important concept, that is research report writing. You just carefully you watch, and if you have any doubt, you ask at the end of the session. In research report writing, there are 3 parts. One is front materials. Second part is chapters, all the 5 chapters. And the third part is back materials. Front materials, main chapters, back materials. So first you have to prepare the main 5 chapters. After that you have to go for back materials. And finally you have to come for front materials, because how much you are giving importance to main chapters, that much important the duration or devotion you have to give for front materials and back materials. So already I told you, if you miss anything, that you will be suffering. Or if you change the order, that also you have to suffer. So the whole research report writing is based on each and every individuality of the university. Mostly there won't be any change. Only in 1 or 2 occasions, some changes will be there. Anyhow, before submitting your dissertation, you get it from the university, what is the mode, then you prepare accordingly. So let us concentrate about the front materials. The front materials you need, so altogether I told you that you have to prepare your dissertation for PhD would be minimum 250 pages. For MSc, it is around 150 pages, 120 to 150 pages. 120 to 150 pages. But now we are not having MPhil, so no need to bother. If it is MPhil, it is around 180 pages. So the front material should be around 25 to 30 pages, and back materials also like that. Then the remaining will be for main chapters. So the front materials, front page is the most important concept. It is like a book, thesis book, a dissertation book. In the front page or inside the front page, top of the hard copy, and also just the inside of the front page, there you have to mention your topic, whether it is partial fulfillment for your degree, because it will be partial only, because you are not, you didn't get a degree, you are going to get degree. So it is a partial fulfillment. And the guide's name also you have to mention, and the logo of the university and the address, it should be there. And when you are going to submit, that should be there in the front page. Front page, the topic should be in slanting order. The first line will be lengthier than the second line will be lengthier than the third line. And you have to mention it is for BSc, MSc or MA or PhD, like that. Guide name should be correct one. You should not spell his initial or spelling, then you will be in trouble. Front page. Next page will be certificate by the supervisor. The supervisor should give, that is, guide should give his certificate. The guide will give you the certificate. It is your own original work. It is the scholar's independent work, guided by me, not previously formed the basis of any candidate or any degree it was used. It is used. So that kind of declaration the supervisor guide should give. So if you do any wrong thing, if you hide anything in this matter, the supervisor also will be affected. You also will be affected. Supervisor guide also will be affected. So your work should be original. The work should be independent, and also it should not be like any other candidate's dissertation like that and all. You should not have done for any other degree. Then the third page will be declaration by the scholar to give your declaration. You have to declare yourself that it is my work, my independent work. I didn't previously formed the basis of any candidate, any degree, like that. You also, you have to give declaration. So if anything goes wrong, both will be answerable. So even after 5 years or after 10 years, if anyone finds mistake in your dissertation, that also you are answerable. So it should be original in nature. Then after 10 years, if anyone gives complaint on your work, then your degree will be stopped, obstructed. You won't be given again. Then the next page will be curriculum vitae. You have to, your biodata, you have to give name, place, date of birth, qualifications, professional courses, professional experience, publications, awards and honors. Around 2 pages you have to give in a short form, you have to give your curriculum vitae. It is not essential for MA, MSc like that. It is very much essential for PhD, curriculum vitae. And you have to dedicate this whole work, you can dedicate to someone. Acknowledgement. Dedication means the person whom you feel that he plays an important role in your life, that person you have to dedicate. It is not mandatory, it is optional only. It is very personal. Source of help, encouragement. You can dedicate your whole thesis to your father or mother, parents, like that and all. You should not dedicate to your guide. You should not be over enthusiastic. So it should be your personal thing, dedication. That will be in one page. In that dedication, you can have some diagrams like flowers, like that and all. Some photos can be in that dedication. In no other page, you should not add any other photos like that unwantedly. So in dedication only, you can have your option. And acknowledgements. Acknowledgement means you have to thank who are all helped your dissertation. So dedication is different. Dedication is for your whole life. Acknowledgements for your dissertation, thesis. So you have to thank them who are all helped. You have to thank the top officials of the university, vice chancellor, registrar, chancellor, like that and all. And faculty members, your guide. You are at any cost, you have to thank the guide only. Then you can express your thanks to your subjects or laboratory or computer assistant or statistical assistant that you got. You can thank them. And finally, you can thank them, the God, your family members and God. But anyhow, you have to thank first of all to your guide only. Then only others will be coming. Then any funding agency, you can express your thanks to them. So you have to avoid flippancy. You can't over adjectives you can't use to express your thanks to them. It should be in proper and simple. It is not effusive. So acknowledgements might be for 1.5 pages. It should not be more than that. Dedication for 1 page. Curriculum vitae for 2 pages. Declaration 1 page. Certificate by supervisor 1 page. And the front page one page only. And regarding the next one is preface. Preface, it is not needed for MPhil. Suppose if they open your dissertation, where the first chapter comes, second chapter comes, the page numbers, you have to mention what are all the information that you have given in that chapters. So like that, you have to what we call a summary of your work. You have to give at the beginning. That is preface. It is very essential. It is of course some universities they are telling it is not essential. That it for books it is very essential. For thesis it is. For dissertation it is optional only. Preface. All other things are compulsory. Then table of contents. It is very, very essential. So which heading comes in which page, like that, it shows the table of contents. Heading should be there. Major subheadings should be there. Minor subheading should be there. You first view how reports are structured, sequence, chapters. It helps locate readily, because if you see the table of contents, whichever you need, you can locate the particular content and the page numbers. So the page numbers and all the table of contents numbers should be Arabic numerals, not Roman letters. So that you have to see in the table of contents. Might be it is around 4 pages, like that it will come. Then list of tables, which tables, whichever the tables you are mentioning. Very particularly, you will mention in methodology and third chapter and fourth chapter, results and discussions, you will show the tables. It is a very quantitative analysis. It should be in Roman letters. Tables, heading should be in Roman letter. First, second, third, like that. List of illustrations. Then tables might be around 2 pages. And list of illustrations around the diagrams, figures, graphs, all will come under illustrations, and you have to mention where, in which page the diagram comes, what is its heading. Everything should be in the list of illustrations in print materials. Then list of appendices. That is, what are all the back materials that you are, the relevant data you are mentioning, that it comes in that list of appendices. So these are all the materials that you ought to have in these front materials. Front page, certificate by the supervisor, declaration by the scholar, curriculum vitae, dedication, acknowledgements, preface, table of contents, list of tables, list of illustrations, list of appendices. So altogether might be it is around 20 to 25, at the maximum 25 pages. That's all. You should not go beyond that. It won't be that much warranted. So this, everything should be there according to its order. You can't change the order also here. That's what I told you. One or two may be changing. Some they need preface, some they may not need preface. So that you have to check it up in your university's rules and regulations. So far we have seen front materials. Anyone have any doubt in this? You can ask now. Front materials. Then we will go for chapters. Chapters, introduction. So 5 chapters, you ought to have 5 chapters. 5 chapters are must for your dissertation. Now in foreign universities, what they are having? 6 chapters. That 4th chapter is divided into 2 chapters. So many of the foreign universities, they have 6 chapters. Whereas in India, so far we are having only 5 chapters. The first chapter will be introduction. Introduction, it should be in scientific language. You can't imaginatively, you can't write anything. Everything should be accurate, perfect, authentic, authoritative, and acceptable. So in that way, you have to. The first chapter shows your brilliance, academic brilliance, your intelligence. It will be tested in this first chapter. So in the first chapter, what you are seeing here, they are the headings that are the must. Introduction, objectives of the study, statement of the problem, hypothesis, significance of the problem, delimitations, limitations, meaning and definition. These we have seen somewhere, studied these things. Anyone?
Proposal.
Proposal.
Very good. Very good. We have seen all these things in the proposal. The only difference between research report writing and proposal is proposal will be in the future tense. Whereas this research report writing, your dissertation should be in past tense, except when you discuss about your tables. The remaining everything should be in past tense, because you are, after completing everything only, you are sitting and preparing your research report. So everything should be in past tense. In proposal, we have seen these things in future tense. Now here you have to present in past tense. Introduction. Already I told you, in introduction, you have to justify why you have taken this topic, and you have to narrate the usefulness of the topic. And the second thing is objectives of the topic. What are all the goals? What are all the major headings of your dependent variables? Whether it is physiological, biochemical, hematological, hormonal, psychological. So they are all goals. You no need to mention separately BMI, BP, like that and all. Headings of that dependent variables you have to mention. And also statement of the problem, purpose of the study. Already I told you, you have to, what is the reality and what you are going to do for that reality. That you have to mention in the statement. Hypothesis. Then significance of the problem, worthiness, and also delimitations, boundaries of the study, limitations, surrounding forces, meaning and definition of the terms, that it should be in short form, not from dictionary. You have to take that already we discussed. You just recall those points, what I have talked about these things in proposal. The same contents will be same, but it will be here, it should be in past tense. So in some universities, the limitations and delimitations order will be changed. For example, in Bharatiyar University in Tamil Nadu, they used to give preference to limitations first, then only delimitations. Because I used to go to so many universities as an external examiner, so I used to see their dissertation, and in these delimitations will come down, limitations will go up. For almost all other universities, they will have delimitations first, limitations second. So these are all the things it should be in introductory chapter. And at the outset, the chapter 1 will be around 50 pages, I already told. For example, you have taken on diabetics means you have to mention what are all the reality statistical reports of the diabetics, its concepts, nature, need, scope, everything you have to give, and the types and everything you have to mention. And what are all the independent variables you are taking for to meet out the diabetics, that also you have to discuss in the chapter 1. So chapter 1 will have around 50 pages. If you want to have relevant photos, you can keep it in that chapter. And the relevant tables, if you want to have, you can show. All other extraordinary photos and all, unwanted photos and all, you should not keep in the chapter 1. So chapter 1 will decide your linguistic or your intelligence in that particular English language. And already I told you, you should not do too many mistakes. That also you have to keep it in your mind. That is, whether it is spelling mistake or grammatical, you should not commit anything. Except 1 or 2 might be, but you should not commit. Then let us go to second chapter. Second chapter, the review of the related literature. That is synthesis of reports on a given related topic. What do you mean by review of related literature? Summary of the previous findings. If you have taken BP means who have all done on BP, that you can show in your second chapter. That so and so, that person had done the same like my topic, and his result is this. His result is this. That result is this. Her results are like that. So like that you have to give. Already I told you, if it is for PhD, it should be, you have to give around 80 reviews. And if it is for MPhil, it will be around 50. MSc and MA, it should be, you have to give 30 reviews already. I told approximately that is. No stipulated rules. That also, why I am asking you to give around 80, then only the examiner will think that you had done laborious work. See, it is not a 1 month course or 2 month course. It is 2 year or 3 year or 4 year. So you have to visit various libraries, universities, colleges, and you have to find the newspapers, social media. What are all the relevant reviews you are collecting related to your topic? It should be mentioned in that review of the related literature. That also it has its own stipulated rules and regulations. So your reviews of related literature should be based on your independent and dependent variables. What are all the independent variables you have taken? That you have to mention. Dependent variables, that also should be there. So accordingly, you, for example, your independent variables will be yogic practices and diet means that 2 related reviews you have to give. Dependent variables, suppose you are taking BP, BMI, blood sugar, or serotonin or melatonin, or life satisfaction or self-confidence. What are all the dependent variables you are taking? That also related around 5 to 10 reviews you have to give for each and every dependent and independent variables. So altogether, it should be around at the maximum 80, I already told you. The review of related literature is, the meaning is summary of the literature. How many reviews you are collecting, each heading, how many critical. What is the review of related literature can be critical and allied. There are two types of review of related literature. One is critical and another one is allied, like primary and secondary research. In the critical research, the reviews should be almost relevant to your topic. Whereas in allied, you can get very closer to your topic. For example, you have taken yoga means you can't give in the critical reviews like football or hockey, like badminton, like that and that. Exactly what related to yoga, if you give, that comes under critical. Whereas in allied, there also it should be some resemblance. For example, yoga, if you are yogic practices, if you are giving, you have to slightly related other training methods you can include. For example, Tai Chi or walking. At the maximum, Tai Chi, very related to yoga. You can't give football, volleyball, basketball reviews like that and all. So critical review should be at the maximum 80% of your 80 reviews. Allied only around 20%. So altogether, already I told you the second chapter also it will come around 40 to 50 pages. Then comes the third chapter, methodology. We discussed in the proposal. Should be related to the objectives of the study. Once again, I remind you that the dissertation submission should be in past tense. Selection of subjects, selection of variables, experimental design, pilot study should be there. In the pilot study, it is a miniature version, fixed intensity, everything you correct it, you test it. That is pilot study. What are all you are having in your mind, you execute it, plan it, execute it, and if there is any drawbacks, you rectify in that pilot study itself. You can't rectify after that duration of your training. Fixed intensity. What do you mean by intensity? Rate of doing work. For example, if you do one Surya Namaskar, how many minutes it will take? At the maximum, you can have 1 minute. And if you want to do Kapalabhati, it is 1 second. One stroke is equivalent to 1 second. So you can't fumble and you can't give unacceptable data you can't give. So you should intensity should be proper. Density means rest. Volume means total duration, repetition, response of the subject, schedule, procedure, materials, everything it comes under volume. For example, you are doing for 3 months your training program means, so all the 3 months the same schedule should not be there. Of course, the procedure may be the same. Schedule will be different. Total duration will be, first month you can have 40 minutes or 45 minutes. Second month you can have around 50 to 60 minutes. And third month you can have 1 hour to 60 minutes to 75 minutes at the maximum, like that. So everything you have to verify in that pilot study. So pilot study is very, very essential. We are not bothering about MSc or MA yoga therapy like that and all. Here in PhD, MPhil also, we ought to concentrate on pilot study. And the criterion measures, what are all the dependent variables, how the tests are being conducted, what are all the equipments we are using and the measurements, everything you have to give it in tabular form in these criterion measures. Then comes reliability of data. You have to ensure everything. Instrument reliability, tester competency, subject reliability, reliability of test. It is the topic of this reliability of data is in general. Apart from that, each and everything you have to give separately. Reliability of instruments, testers reliability, subjects reliability, orientation, also scheduling. Scheduling will be for first month, second month, third month, differently you have to give. If you have two independent variables, two type of scheduling you have to give. And if duration also you have to mention. In scheduling itself, around 10 columns will be there. You check it up. So serial number should be there. And what is the practice you are going to give, name of the practice should be there. Duration of that particular practice should be there. What is the rest period, total duration, how many repetitions, and how the breath duration, everything should be there. The frequency means how many days you are giving training program per week. That shows your frequency. It is being known as frequency. So scheduling itself will have around 9 to 10 columns. That's what you have to do. Before preparing your research report, you check and go to various universities, like university libraries. They will keep all your dissertations, all others' dissertations. You check it up, go through how they formed, how they framed their dissertation, and then you follow like a questionnaire. In order to prepare your questionnaire, how you are going through previous questionnaires, like that you have to search for the previous research dissertations. Then test administration, how you are going to conduct the test. And after that, collection of data. You have to summarize that reliability of data is the general concept. That is, if it is introduction like that, conclusion of data will be the concluding matters, collection of data. Then statistical technique. What statistical technique you are following? For example, if you have two independent variables and also controlled variables and dependent variables, it will be better for PhD and all, you have to go for ANACOVA. And also you have to go for post-hoc test, that is Cepheids post-hoc test. ANACOVA for the differences to find out among the groups. Whereas post-hoc test, that will find out the results of paired mean differences. Experimental, post-hoc test won't include control, what we call control group. Except the control group, remaining differences will be considered among the groups that we have to use for post-hoc test. That is, generally we used to have Cepheids post-hoc test. So these are all the concepts that you have to keep it in your third chapter. That is methodology. Now let us come for fourth chapter. Very important chapter, results and discussions need to be discussed with professor. You can use any professional statistician. Already I told you, for giving training, you can't appoint any other deputy to you. Here you can get some experts help for your statistical report. That is allowed. But you can't appoint your trainer or someone else for giving training. You ought to give your own. And you have to tell that you have given in person, not with others' help. So in the fourth chapter, there are so many headings: overview, test of significance, level of significance, computation of statistical technique and post hoc test, results on dependent variables, discussion on the findings of dependent variables, and also discussion on hypothesis. These are all the major headings of your chapter 4. Overview means just you give an introduction for your results and discussion. You consult, you check it up with the previous dissertations, you will get some ideas. Then there is a difference between test of significance and level of significance. Test of significance means which level you are going to use the errors, 0.01 or 0.05. Usually in yoga, we used to have 0.05 level. For medical degrees or those who are having latest, accurate, appropriate instruments, modern instruments, if they use, then they will go for 0.01 level. One error may be possible there. Here, 5 errors can be possible out of 100 like that. So test of significance shows which level you have selected. Level of significance means obtained values you have to compare with table values that we will see in our model, what we call slide. And your hypothesis to be accepted or rejected, you have to tell in your level of significance. Then computation of statistical technique and post hoc test. Which technique you are using and which post hoc test you are using, you have to mention and you have to give the results and discussion should be there. Results of dependent variables, you have to mention next. Then comes discussion on the findings of the dependent variables. So each and every result of the dependent variable, already I told you around 5 you can have at the maximum. If you have taken more than 10 or 12, then you will be caught hold of that external examiner. That you have to keep it in your mind. The above findings can be, these lines should be there when you discuss the results of the dependent variables and the discussions after that. Finally, you have to conclude. The above findings can also be substantiated by observations made by the expert like Madan SR 2003. This is example I am giving. For each and every results discussion, the final sentence you have to quote from, you have to take it from second chapter. There you have given some reviews, From there you take a particular 1 or 2 observations and you mention here. I am also telling the results and discussions. The previous persons also, they had their own results and discussions. Both are alike. Like that you have to tell in your discussion on the findings. The above findings can be substantiated. My findings can be substantiated by the observations made by the previous experts, previous research, previous reviews. That you have to tell. And finally, discussion on hypothesis. What is your hypothesis in the first chapter? Now you have to connect that with here the discussion. So each and every chapter is interrelated. The first chapter hypothesis, you have to rely on, you have to discuss on chapter 4. So you can't bluff anything previously and you can't tell anything later. So everything are interrelated, you please keep it in your mind. For example, I am the external examiner. Correcting dissertation means whether it is your work is correct or not, I will check it up in 3 or 4 angles. In delimitations, I will see what you have given about your subjects and variables. That I will check it up with 3rd chapter. Then the 3rd chapter, is it the same? I will check it up again in the 5th chapter, summary. So everything should be same. So suppose you are taking diabetic men, you are mentioning diabetic men in delimitations, but you are telling diabetic woman in Third chapter, methodology. And again, you are telling in the fifth chapter, diabetic men. Then I have my own doubt. It is whether it is original or not. So everything should be very easily we can see the false or whether it is a correct one. So we are having our own some potential points. There we will see and we will finalize, we will give our own final opinion whether it is done independently, perfectly or not. So experience will help a lot for us. And regarding, here I am giving one example. So that we are seeing a body mass index. Analysis of covariance we are using. Now you can see, we have taken 3 groups, group 1, 2, 3. And also source of variance, sum of squares, degrees of freedom, mean squares, obtained ratio, values, pre-test, what is the data, post-test, what is the data adjusted post-test mean, and also mean gain. So everything we will see, and very easily we can see whether your hypothesis is accepted or not. We can see from here. Your obtained F ratio, you see, for example, 7.39 and 83.42, whether it is greater than the table value. Table value is given at the bottom, see, 3.22, 3.23. And the degrees of freedom also we can check whether it is 2, your subjects 45 or 40, 60 or 30. So we can easily see, you can't bluff here in degrees of freedom. So degrees of freedom we will see, obtained values we will see, and very particularly we see the difference. For example, body mass index. So group 3, that is controlled group. Controlled group's body mass index is 27.77. You are seeing here. And definitely after yogic training, it should be reduced, isn't it? It should be decreased. That is, it comes 26.01. And group 1, that is yoga and diet, 24.9. Yoga without diet, 26.01. So your controlled variable, controlled group's data is 27.7. So the result should be better than the control group, you know. So 27 becomes to 26, 26 becomes to 24. Then we can come to the conclusion this table is correct. We can easily find out the mistakes here. So the obtained, the last column, obtained F ratio, obtained values should be greater than the table value mentioned at the bottom. Then only your hypothesis is accepted, otherwise it is rejected. Then comes Cepheus post hoc test for body mass index. Again the same. Now you can see the difference. The required class interval, that is 0.80. Mean difference 1.14, 3.52, 3.52, 2.37. So group 1, group 2, group 3. Now here we can easily find out the correction. If the mean difference is greater than the required class interval, then it is your hypothesis is accepted. That is, it is significant at 0.05 level of confidence. So these things you can easily come out and you can find out whether your data is correct or not. Then you have to go for bar diagram. Bar diagram is a must. Tables are the must. Results and discussion. So here there are so many graphs are there, but we usually in yoga, we used to have bar diagrams because we are comparing groups. So we are using bar diagram here. So no need to see values or these results and other data. If you see the bar diagram, easily you can come out how the improvement is. So By seeing bar diagram itself, we can come to the conclusion. Then comes the 5th chapter. So far all the 4 chapters should have around 50 pages. Whereas in chapter 5, it will be at the maximum 4 or 5 pages. And the remaining, we have already seen front page and back materials, 20. So altogether, you will have minimum 250 pages. This is the very, around 4 to 5 pages enough for your chapter 5, summary, conclusions and recommendations. Summary means you have to summarize everything within that around at the maximum 1.5 pages. From chapter 1 to chapter 4, you have to summarize everything and you have to give in this summary. The purpose of study, methods, results in brief, everything you have to give around 1.5 pages you can give. The conclusions, it should be understandable by a common man. Whoever sees your dissertation, easily they have to understand whether yoga helps diabetics or not. Easily you have to tell. You can't give all your extraordinary opinions here in this conclusion. An ordinary person should understand whether yoga is good for diabetics or not. It should be easily understandable. And also it is based on 1st chapter. So conclusion should be there, might be around 10 lines, that's all, at the maximum 10 lines. No need to give extraordinary points. And also then comes recommendations. Ideas to practitioners, suggestions to government. 2 aspects you have to give your recommendation. One is for the practitioners and the government and the society. And the second part of recommendation should be for your juniors, future scholars. So suppose if I want to locate a topic, I will go through all the previous dissertations. Straight away, I will go to recommendations. There we can get so many topics. Each and every one will give around, at the maximum, you can get it minimum 10 topics like that. So recommendation should have 2 parts. One part is practitioners, government and society. You have to give your ideas, your recommendations. Second, recommendations for your scholars. So it should be around 1 page altogether. So these are all the materials that should be in that chapter 5. And it comes last, that is back materials. Back materials, 3rd part. The back materials include bibliography, that is useful references, and also the back materials. Bibliography should be unpublished dissertations, theses, website references you can give in that bibliography, and appendix should be raw data, questionnaire you have to give, description of the test forms, subjects letters, list of cooperating individuals and institutions. The back materials already, these 2 you ought to give, bibliography and appendixes. And the external examiner will see how many references you have given. See, you can escape from your state examiner or your other state examiner. You can't escape from the eyes of the external foreign examiners. Each and every line they will read out and they will give their opinion. for example, in one concept, he gave so many references, book references in the first 5 chapters. In the bibliography, he had given only 10 books as reference. Then the external examiner asked, so why this parity? Why this difference? So you have done wrong. You repeat your work again. Like that, they may tell, the external examiner will send his suggestions. Then it will take delay. Your degree will be getting delayed because of some small mistakes. So it should not be there, that you have to keep it in your mind. So everything you have to do with utmost concentration and with utmost sincerity, you have to prepare your dissertation. So before ending our sessions, again, I told you regarding mechanics of writing proposal. That also is applicable here for your research report also. So the whole dissertation should have simple language. There should not be any grammatical mistakes, spelling mistakes. Your dissertation material should be 1.5 space. Use A4 bond paper with Times New Roman, 12 font size for each and every letter, and headings can be 14 font size. For each and every page, around 27 lines can be at the maximum. And also quality bond paper you have to use. The margins you have to leave left side 1.5 inch and the right side at the bottom and the top 1 inch gap you have to give. The pages should be in Roman letters in front materials. In front material, top of the bottom, bottom page, in the bottom area that you have to mention the page numbers in Roman letters. Center of the bottom of the paper, you have to mention front page, front materials only I am telling. For remaining material, for remaining papers, you have to continuously, you have to give number in Arabic letters. Only chapter, each and every front page of the chapter, you should not mention the page number. All the page numbers you have to write, top of the right corner, you have to give number in Arabic format. So the first page of each chapter won't have its number, but it should be continuous one altogether. That you please keep it in your mind. Also, you mention, if you mention anything below 10, then you write it in 10. You don't mention 9. You mention NINE, 9, like that. So these things you have to keep it in your mind. The percentage also, if you want to quote 21%, you mention either 21% like that in words, or 21, then you percent, that and all you should not have. So you when you are not giving, the word percentage should be used. For example, 21%, like that you have to give. Symbol you can use 21%, or TWENTY, 20, ONE, 1%, PERCENT. So you can give either number or words that you have to follow. So binding should be cardboard, hard binding, and you have to verify in your university how many copy should be submitted, how many soft copy and hard copy you have to hand over for your whole dissertation. That also you have to verify with your university. So these are all the things that you have to keep it in your mind related to research report writing. If you have any doubt, you can ask now.
Sir, how to collect unpublished data from the thesis?
Pardon? Pardon? Tell me.
No, how to collect unpublished data from the thesis?
Published?
No, unpublished. That raw materials, no?
Raw materials, the data, what you collected, raw data, that you have to mention, questionnaire you have to mention, and any permission letter you have to mention. So that comes under appendices.
No, unpublished dissertations.
Published dissertations you can take as a review, you can take, but you have to mention. So all back materials, you go through some books and accordingly you write how you have to write your bibliography. Books, journals, books references you have to write in a different way. Journal references you have to write in a different way. And the website references you have to write in a different way. But you check it up and you do accordingly.
Hello, sir. Sir, could you please repeat the last part of bibliography? How many books we have to include in the PhD in reference, in PhD thesis?
No, PhD I told 80 references, whether it is books or so many other collections.
Okay.
This bibliography, you know. So 80 references, the 80 references we have to quote in reviews. Apart from that, you may have some references in that first chapter and second chapter and third chapter also you may have some quotes. So altogether, everything should be given in your back materials in bibliography. Not exactly 80 what I told. 80 reference reviews I told. But some references you might have given in chapter 1 also. Whether it is from book or journal or unpublished dissertations or thesis, websites, might be, so on. So these back materials only, this bibliography alone, it will come around 7 to 8 pages.
Okay, thank you.
So if you want, I will send, I have written one book on research methodology in yoga. So you can verify the back materials there also.
Okay, sir. How can we get that book, sir?
No, I am not having a book. It is out of publication. That I will send the copy, soft copy to you. So for example, you are giving quoting book means the author name will be there and which year it has been published, what is the name of the book, who is the publisher, in which place it is published, and who is the publisher, and which page number you have taken as reference. That and all you have to give in books. For example, I am telling.
Okay.
Namaste, sir. Namaste, sir. This is Shantam, sir, Bangalore.
You are so sincere. I appreciate you. Tell me.
Yes. Sir, part-time you told, no, sir. That means we have to be physically available to do part-time.
3 months per year. You have to be at the university 3 months, not 12 months.
Because we are working and
working people only will be allowed to do part-time. Working people only will be allowed to do part-time, and even that 90 days you have to be, as per the rules, you have to be in our university, whichever university. It is common rules and regulations for throughout India.
Yes, sir. We will not get 3 months leave and all, sir. Any
that
other possibilities?
You are answerable. That and all you are answerable.
Yes. Okay, sir. Thank you, sir. Thank you.
Respected sir, please share your contact number.
7358 7358 28 1920 7358 28 1920. I hope that I am not going past 7358 28 1920. In radios and all, TVs and all, they will read the phone number very fast.
Sir, in part-time, there are 3 months contacts in university.
Pardon?
In part-time,
we are having.
three months.
Meenakshi Academy of Higher Education and Research.
Yes,
We
3
are
months.
one of the deemed universities approved by UGC. It is in Chennai, and we are running PhD full-time, part-time, and also we are having the courses like MSc Yoga, MSc Yoga Therapy, BSc Yoga, BSc Yoga Therapy. We are having all these courses.
Yes, sir. Sir, for part-time, 3 months contact per year.
Yeah, it is essential as per UGC.
Yes, is any specific time there, sir?
No, you have to be depending upon the guide. Upon the guide. If he tells that you have to be there throughout the day, you have to be there throughout the day.
Okay. Only the 90 days is required for 1 year.
1 year. Yeah.
Okay, sir. Thank you.
So at the outset, I told already, UGC is very strict nowadays. So they are very much looking out for plagiarism, and also 2 publications are very essential for you. You should be in the topic, your own topic. So you have to each and every year or now and then they used to change the rules and regulations. So it is applicable for you also. So you follow the rules and regulations of the UGC at the outset. And our university also comes under University Grants Commission.
Sir, in this bibliography chapter only, you told that small things can stop your degree. Sir, I couldn't listen that point. Could you please repeat?
No. See, after submitting your dissertation, it will go to 3 examiners, and they will verify your work. One within the state, another beyond your state in India, third out of the country, foreign examiner. So they will see and they have to accept your dissertation is commendable. They have to tell like that. If they find any fault, then some they will tell you correct yourself and you conduct viva. Some they tell you correct everything, again you send for correction. Some they will tell like that. And some others they will tell the whole work is not satisfactory, you do from the very beginning. They may tell like that. So it depending upon the situation. That's why I am telling, whatever you are going to submit your dissertation, prepare perfectly and hand over. Immediately you have to have your BioVOC. Otherwise, already you have done 2 or 3 or 4 years. Again, you have to wait for another 1 or 2 years. That's what I am telling. So do it perfectly and hand over dissertation appropriately. Because so many restrictions will be there, so many rules and regulations will be there.
Okay.
Namaste, sir. What is the best time to reach you, sir? I just completed my MA Yoga and I'm planning to pursue PhD. I qualified UGC NET.
Okay, good, very good. You are having very bright future if you do PhD. Once again, I want to tell you all, in 2 or 3 years, your PhD work, if you have done PhD, then only you will be permitted to be appointed in any college or university. So PhD is mandatory for your assistant lecturership. So please, you complete so far you have done your 10th, 12th, then degree, then you have done your PG degree. Only one thing you have to complete, that is PhD. So try to do PhD also. Then you will be the one. So for example, what is your name, ma? Your name?
Radhika. Radhika,
Radhika.
sir.
Radhika, you have done already, you had qualified NET exam. And if you have done PhD, then you will be the number one candidate for any kind of interviews. Easily you will be picked up. So you are having very, very bright future, Radhika. Keep it up.
Okay, sir. Sir, I'll get in touch with you, sir.
Okay,
I'm interested to pursue. Okay, thank you, sir.
Okay, thank you.
Hello, namaste, sir. Lensa Desai.
Please.
Raji Desai, National Institute of Yoga, and I did my graduation out there, BSc Yoga Sciences, and now I'm gonna pursue masters in yoga therapy. So, is there any entrance examination?
Yeah, definitely. Whichever university you want to do PhD, entrance exam will be there. I know all your lecturers and your director in MD NIOI. So I used to come often before COVID. So you are in good institution. The thing is, you do PhD for any university. If you want to do PhD, entrance exam will be there definitely. For example, if you have done NET exam, I mean MPhil, then NET exam, you will be exempted. Otherwise, you have to go ahead of written exam also.
Okay, sir. Thank you so much, sir.
Those who qualified in NET exam are exempted for writing initial written exam. Straight away they can go for oral interview and they will be selected if they are satisfied with your performance. And what is the importance of MPhil? When you complete when you are going for your course exam, after joining your PhD 1 year later, if you write that course exam, your 2 papers will be exempted. Remaining 2 papers you have to attend. So anything else? So at the outset, we express our sincere thanks to you all for having graced your valuable time for all the 10 days. And on behalf of our university, Meenakshi Academy of Higher Education and Research, deemed to be university, on behalf of our Chancellor, Rector, Vice Chancellor, Registrar, and the Dean Research, and all our faculty members, we express our sincere thanks to you, and let us meet again appropriately. Good luck. Thank you very much. Thank you.
Thank you so much for all the informative
Thank you.
Thank you, sir. Thank you so much.
Thank you very much, sir. Hari Om.
Thank you, sir.
Thank you.
வாழ்க வளமுடன் சார்.
வாழ்க வளமுடன். வாழ்க வளமுடன்.
Thank you, sir.
Thank you.
Thank you, sir. Thank you, sir.
Thank you.
Thank you, sir. Thank you for the wonderful webinar.